Hello. Good morning. Happy Monday. We are moving into Easter week, which is fun. And I wanted to come on to, like I said last week, I actually wanted to make this a little bit more consistent because I think it's good to be able to have these conversations and then kind of save these conversations for later. So you can, if you're not in the position to watch them live, you have the content to watch. Also, if you're here on Instagram, I'm also live on YouTube. And if it's an easier platform to watch, then meet me on YouTube. So I wanted to talk today about women's health and the microbiome because this is a topic I am super passionate about. Why would I talk about a topic that I'm not passionate about? So, um, microbiome is basically the bugs in our body. And I think that where a lot of people miss the mark or where a lot of people don't understand the microbiome is the wide impacts and the wide influence that the microbiome has on kind of the body at large. So, not just on the gut. Like when we think of microbiome, if you know anything about the microbiome, you're probably thinking, okay, gut, and then further to that, you're thinking, okay, probiotics. But ultimately, it comes down to so much more than that. And it's, when we talk about fixing the microbiome and shaping the microbiome, it's also about so much more than probiotics. So I'm just going to put in the comments, we're chatting. And women's health. Comment. Okay, and I'm just going to put that on YouTube as well. We're chatting about the microbiome. Okay. So let's talk about a few things. I'm just going to pin my comment on YouTube. All right. And if you want to find me on YouTube, if it's easier to watch, same name, Dr. Laura ND. You can find my YouTube channel. Okay. So when we look at the human microbiome, research is actually showing us that it is a massive regulator and a central regulator of health in general. And so when I'm working with patients, a lot of people will see me because they have hormone issues or they're in perimenopause, or there's a fertility issue going on. And they're often shocked when I'm like, okay, like let's talk about your gut. Let's fix the microbiome because research tells us, and clinically we see that working on the microbiome tends to fix a lot of things. So it really is the root cause for so many things. When we talk about the women's microbiome specifically, most of the research, as you can imagine, has been done on men. And so now research is finally coming around and looking at the role the microbiome has in the female body on a lot of these health outcomes. And I think that this is a really big deal because we see the differences between the male and female microbiome. And it's a really big deal in terms of how we look at health and health outcomes. And so we know that women's microbiomes are distinct, dynamic, and hormonally driven systems. And the impacts of the microbiome include immunity, metabolism, hormone regulation, reproductive outcomes, mental health. And so let's talk about something known as the hormone microbiome axis. So there's this bidirectional relationship that exists between the hormones and your microbiome. And essentially, we're looking at them kind of working together. We see this in women. First of all, we see that the microbiome impacts hormones. We have something called the estrobolome that influences how your estrogen is metabolized. So certain bacteria in your gut can actually dictate whether or not your hormones are metabolized or how efficiently they're metabolized. And not a lot of people know that. We also know that microbes in your gut can actually influence enzyme activity, which can alter your hormone recycling. So it's this big system where, again, if you have hormonal issues and you're constipated and we don't treat that constipation, we're not treating your hormone issues, right? So that's really important to understand when we're looking at hormones from a root cause and hormones from a bigger picture. We also know that estrogen and progesterone shape the diversity in your microbiome and the stability. So the ability of your microbiome to stay kind of the same or the ability of it to change is really, really dictated by your hormonal shifts. And this is why at certain periods in a female's life, which we're going to go through all of those pieces, we see shifts and changes in the microbiome as we see shifts and changes in the hormonal landscape. So that's kind of the long and short of it. But ultimately, like clinically, we see this. A patient comes in, they're like, oh, I hit perimenopause, my hormones changed, and all of a sudden my gut changed. And so I see, women in perimenopause having more digestive issues, having more sensitivities to foods that they, never did before. They're like, this just came out of nowhere. Ultimately, it is the result of all of these hormonal shifts that we have, right? And so when we have dysregulation in our microbiome community, we see infertility, hormonal imbalances, chronic inflammation, metabolic disease, and we see the microbiome across many of these body systems. So what's interesting about the microbiome and your gut bugs is it's not just in your gut, right? The way I explain to my patients is we have bugs, like we're pretty much 99% bugs, right? In some capacity. We have bugs in our mouth, on our skin, in our gut, obviously, but also in our vagina, in our uterus, everywhere. We have a microbiome, and that, research more and more is showing is a regulator of a lot of things. So interestingly, the gut microbiome is a central regulator of your metabolism, of insulin sensitivity, of inflammation. We talk about this concept, and with her Metabolic Confidence Lab program, we're currently talking about the impact of, the metabolism on all the things. We're looking at inflammation. We've talked about this concept of inflammaging, which if you don't know what that is, I've posted a carousel recently on it. So you can just go take a look at that. But essentially, we know that, a really common, I guess, catchphrase is inflammation. I want to lower inflammation. This supplement lowers inflammation. This tea lowers inflammation. But what does that really mean? And where does inflammation come from? Inflammation at the end of the day is super non-specific. And so when we're looking at where it comes from and how to treat it, it's so much more than just like a one supplement. Companies would love for it to be the case, right? But it's not. Inflammation comes from the gut a lot of times. And a lot of people don't want to admit that or deal with that because we know that gut work is more than one supplement. And I'll talk about that kind of at the end, circle through why I think that's important and why I think more people need to understand this. But the gut is a massive regulator of inflammation and insulin sensitivity. If you're, struggling with insulin resistance or chronic inflammation that just won't be, doesn't seem to be changing, then the gut is a really, really great place to start, even if you don't have overt digestive issues. And I would also argue that, funny or not, we only know our own digestive function, right? And so if I'm like, how's your digestion? A lot of patients will say normal. And again, my argument is you wouldn't know if it wasn't normal, right? So when we look at what specifically happens in the gut, we see that your microbiome can produce certain metabolites that can influence brain function, hormone signaling. When we look in the vaginal microbiome specifically should be dominated by bugs known as lactobacillus. And so lactobacillus is kind of like the main bug that helps maintain a low pH. We know that we have to keep a low pH in the vagina because that helps us maintain a healthy state. This protects against infection. And we know that dysbiosis of that healthy state has also been associated with infertility, BV. We know that a dysbiosis in a pregnant individual increases the risk of preterm birth. And so we know that keeping that vaginal microbiome is actually really important. I see patients and, we'll walk through their BV or their yeast infections, or maybe they just feel like they get an odor or discomfort. And when we start to line it up in their cycle, we notice that it happens every time in the same time of the cycle. After their period's done, they find that they get like a yeast infection. And it's partly because the microbiome is, imbalanced, and then the impact of the menstrual fluid coming through everywhere further influences that microbiome. And when the microbiome is not stable, it doesn't have that capacity to kind of like bounce back. And so these patients tend to have these recurrent issues, whether it's an odor, whether it's BV, whether it's a yeast infection, could also be a UTI that happens, cyclically because of what we see with how the hormones are moving throughout that time, right? When we look at the reproductive tract, we know that the microbiome in there can influence implantation, the immune tolerance in pregnancy. A lot of people, whether they want to get pregnant in the future or they're trying to get pregnant now, they're worried about their hormones. They're worried about, rightfully so. They're worried about, what are my hormone levels? What are my hormones doing, etc. But ultimately, we know pregnancy is an immune system reaction more than anything, right? It's the ability of your immune system to function in a way that accepts this like foreign entity, i.e. the embryo, to be implanted and to stay there and to grow, right? And we know the microbiome actually can play a big role in that. And research shows us that the microbiome influences things like IVF outcomes and IUI outcomes. And this is a big reason why in the fertility world, they're starting to do a lot of testing of the microbiome. They're in certain clinics, that's actually becoming kind of standard in what they do and how they assess their patients because of this research on the microbiome. So it's a really, really big deal. And we even have research on breast tissue microbiome, right? We have emerging evidence that shows influences in immune signaling, and that the microbiome in the breast may actually play a role in the develop of or not develop of breast cancer. We know in the skin world, in the aesthetic world, in the dermatology world, there's a lot of talk around the skin microbiome and supporting the skin barrier and everything of that nature as well. So those are just things to consider in terms of all of the places that the microbiome plays a massive role in overall health. Now, again, I've kind of alluded to this, but we see transitions in life stages. The microbiome changes as we go through ages and stages in the female body. We don't see these same changes in the male body, right? And so in the when we have a menstrual cycle, we know those hormonal fluctuations throughout the month cause microbiome shifts. These shifts can happen locally, again, in the vagina, in the uterus, but also it happens in the gut. Again, estrogen is what promotes and really keeps and maintains that lactobacillus dominance. So that lactobacillus bacteria, the bacteria that we really want to see in the vagina, estrogen is what maintains that and actually keeps it there. So that's really important. And we know that some patients might experience BV or yeast infections with their cycle because of the inability of the estrogen to stay kind of balanced and regulated in that state. And also, I find that there has to be a little bit of a vulnerability, because you're like, well, why doesn't everybody with a period get a yeast infection at a certain time, right? Like there's this pre-existing vulnerability of that microbiome not being able to stay lactobacillus dominant. And then in pregnancy, we know that the microbiome becomes more stable and less diverse, and that has to do with the protective adaptation of pregnancy, right? It's more of an immune response than a hormone response. This supports your immune tolerance and fetal development. That's the role of pregnancy, is to be able to tolerate something that is technically foreign, right? And then in menopause, we know in perimenopause, we have estrogen doing this for a really long time before it finally plummets. Like that could be 7 to 10 years. And so we know that that estrogen changing influences the lactobacillus that's there. So lactobacillus goes down, your vaginal pH goes up, you have a higher infection risk, you have a higher UTI risk, you have a higher yeast infection risk. Again, I'm going to plug my upcoming Not Your Mom's HRT, because I think vaginal health is something that we don't talk about because we're so embarrassed and scared. And if our periods are so regular, we don't bring it up because we're like, well, I don't know what's happening. My periods are still regular, but I'm getting these UTIs all of a sudden, or I'm getting these, I'm getting this BV all of a sudden, or I have this like weird odor I'm super embarrassed about, right? And so when we talk about this, on April 9th in person or live on Zoom. We're going to talk about the impact of hormones on vaginal health and how we can prevent a lot of these things, how we can prevent UTIs and yeast infections and BV. But we know when we look back at the root cause, the issue is estrogen changing. And so I see so many patients, they're like, yeah, and I had a UTI and then I had another UTI. And now they've been on like 7 rounds of antibiotics before their doctor has actually said, oh, maybe we should be considering vaginal estrogen as part of this treatment plan, right? And so I think that's an important thing to kind of circle back on is what are some of the microbiome changes that are leading to this as a root cause. And so when we're in perimenopause and menopause, we also see changes in the gut microbiome, right? Again, the hormonal fluctuations change our microbiome everywhere. It's not just the vagina. That has to do with our risk and everything else, but our microbiome changes so that, again, we have these food sensitivities. It's like the food never used to bother me. Now it's bothering me all of a sudden because of the changes in hormones. If you want to talk more about that HRT, my HRT presentation is next Thursday, the 9th, 7 p.m. You can find the link in my bio if you want to register for that. But this conversation is not about that. We know that, as you enter perimenopause, you're more likely to have more bloating, more constipation, etc. And again, we know the microbiome is a central driver of disease, right? Like this is why when I'm working with my patients, mood, perimenopause, PCOS, endometriosis, infertility, chronic inflammation, insulin resistance, I'm looking at the microbiome. And I circle back to this, like, jokingly that, like, oh, but my poop's fine. Like nobody wants to talk about it. If they don't have life disruption from their digestive system, they just don't want to talk about it. And I think because obviously, like in society, we haven't normalized talking about our digestive system as, talk over, in the coffee shop. But again, in your appointment with me, I'm like, let's talk about your digestive system. And also let's talk about your microbiome, because if you go on the internet and you look up PCOS and microbiome, endometriosis and microbiome, insulin resistance and microbiome, obesity and microbiome, there are certain microbial signatures that you'll see in people with obesity and without. There are certain microbiome changes that happen that promote the findings we see in PCOS. And we also see that treating that microbiome is part of the bigger plan in order to fix these things. We know that treating the microbiome is a big deal in reducing chronic inflammation, in treating insulin resistance, in treating PCOS, in the treatment plan of endometriosis. And it's so much more than just adding a probiotic. And this is why a lot of the research is mixed, because a lot of times when we do research, we want to say, does A equal B? Like if I take a probiotic, does that mean my PCOS is gone? Or does that mean that it changes the microbiome signature that's apparent in PCOS? And the reality is, like, sometimes yes, sometimes no. I would argue that it has a lot to do with what your baseline microbiome looks like, right? I often look at the gut microbiome because this is, the place we start, the gut microbiome as a community, right? And so we have this community and we have to do things to disrupt the community. Sometimes adding in a probiotic doesn't do enough disruption to that community, especially if it's so far off. But we do see the microbiome being a huge role for metabolic health, right? We know that there are certain bugs that actually increase the caloric extraction from food. You're actually going to take more calories from that food with certain microbiome patterns, right? We know that there are certain bugs that are associated with obesity. We know there are certain bugs that are associated with your increased cravings, etc. And so when we look at the big picture, even when we're like scaling it back to weight loss as like a very niche topic, it's like, yes, we need to be in a calorie deficit, but like how we get there, I always say, figuring out the numbers is one piece of the puzzle, but how we actually like arrive at doing that in real life is another piece of the puzzle, because there are so many things that interfere with us along the way to that math. And one of those things being your gut microbiome, right? If you have a microbiome that has a greater tendency for you to be inflamed and insulin resistance, well, then how are your hunger and satiety cues going to be balanced, right? And so if your hunger and satiety cues are not balanced, how are you going to stay in that calorie deficit that we've so lovingly set out for you if you're not in a state to actually have a hormonally balanced day, right? And so the microbiome is often like that missing layer in metabolic dysfunction that I really like to look at. Now, when we look at the gut-brain axis, we also know that the microbiome is associated with mental health outcomes as well, particularly anxiety, depression, mood instability. That can be through a number of things, but a lot of what we see is linked to what's known as neuroinflammation. So again, if the microbiome has the capacity to create inflammation, it typically has the capacity to have that inflammation cross the blood-brain barrier and lead to neuroinflammation, which influences mood. And I actually made a post about this recently about specifically perimenopause, anxiety, and that gut microbiome connection. I think it's a fascinating thing to look at because we know that estrogen, again, is responsible for a lot of the changes in the microbiome. And then we actually see a heightened anxiety in perimenopause. And in fact, it's one of the major concerns that my patients are lately coming in with. Like, they're like, I have a regular period. I am so anxious, I can't even function, right? And so a lot of that can come down to the microbiome and how that is functioning in perimenopause. Now, when we look at kind of perimenopause, I've posted about this before. Like I said, you can go check. I have a carousel post on anxiety in the gut. I think it's really interesting, the connections between those things. When we look at microbiome-based interventions, a lot of the times we're talking about probiotics, which again, we know probiotics are strain specific. They go in, it's the good bugs we're putting into the system. But in my opinion, if the environment doesn't have the capacity to accept those strains, then it's not going to do anything, right? It's like we are making a garden, and I don't know anything about gardening, but I like this analogy because it's really easy for people to understand. Is we have an environment with really crappy, light brown soil. I'm not even a gardener, and I know that's not the best optimal environment to grow my flowers or my vegetables, right? And so if I take that gross, weird, light soil and I put probiotics or seeds, right, on top of that, what's going to happen? And I don't water them, right? They're not going to grow. And so I look at this concept and people are like, oh yeah, that makes sense. So if your gut has a crappy environment with no way for these, probiotics to actually grow, i.e. fiber, right? We have to feed the probiotics with prebiotics. So if you don't have that environment in your gut, you're just going to take those probiotics and they're going to do absolutely nothing. Or it's going to be one of those scenarios where you take them and you feel really good while you're taking them, but as soon as you're done taking them, you don't feel good anymore, right? And so we have to look at those situations as well. People are like, oh, probiotics can make me feel better. Well, did you have the gut environment that, was ready for those probiotics at that time, right? Then we have prebiotics. These feed the beneficial bacteria. So again, we have to have optimally a setup where our gut bacteria is like ready to perpetuate that cycle, to actually, have the probiotics take residence there, for lack of a better term, right? So we know that lifestyle and environmental factors influence the microbiome. Major drivers, as you can imagine: diet, antibiotic use, environmental exposures, stress, hormonal changes. We're even seeing in research that the microbiome is, started in the womb. So we can actually see babies developing their microbiome from all of the ways that they're birthed, right? C-section versus vaginal birth, breastfeeding versus not. We see the changes in the microbiome with respect to that. Again, stress. A lot of people will underestimate the role of stress, the role that stress plays in the microbiome, the development and the changing of the microbiome. And that's a reason why it's like somebody has chronic inflammation and we just can't get a handle on it. It just won't, go down. It just won't change. And we look at their lifestyle and we're like, okay, well, you're still not eating very healthy and you're super stressed, not doing anything about that piece. And so we have to really look at, okay, how is the stress component influencing your gut microbiome, which is influencing the inflammation in your body or the insulin resistance in your body, right? And so to kind of summarize this, I would say you can't treat your hormones, your metabolism, your mood without considering the microbiome. And so what else do we do? Again, looking at the gut like a garden as kind of like your core base microbiome. Again, we have this garden, we have this crappy old soil. What do you want to do? You want to make sure that there's really rich, diverse, nutrient dense soil before you're going to go plant those seeds. And a lot of times, a lot of these crappy soil gardens have weeds. And so we have to get rid of the weeds. Using antimicrobials can be a really great strategy. We know that there are certain antimicrobials, like garlic, for example, that is known to be, antibacterial, antifungal, can reduce pathogenic spores. We know that it's anti-inflammatory. And really, I would say it's probably exerts its anti-inflammatory benefits based on what it does to the microbiome. It also has cardiovascular benefits. We know that garlic at lower doses can be more modulating, but at higher doses can be more suppressive. So you really have to know what you're doing in terms of like what dose, how often, how long. And this is where we do a lot of our, microbiome targeted strategies before we work on hormones. I guess as we're working on hormones, I look at health in, 4 pillars. It's not as easy as like, take this one thing, do this one thing. And if it is, in my opinion, you need to see someone else because it should be more complicated than what you can Google yourself and do in kind of like one shot, right? Specifically, things like ginger, we know can actually affect bacterial and virulence factors, can influence microbial adhesion. So again, the ability of the bacteria to actually like attach and stay, ginger can reduce that. I love to use ginger because it's also a motility agent. So for my like chronically constipated people, again, if the poop is not moving through, there's going to be things that are going to be stagnant. There's going to be bugs that are going to stay in that area. And so ginger can act as a motility agent to just gently move things through. But also, while it does that, it helps reduce inflammation as well. Lots of people don't think of things like turmeric or curcumin as we think about it as anti-inflammatory, which it is a strong anti-inflammatory agent, but also can cause, gut barrier support. So it's kind of like a microbiome modulator and can help with your inflammatory signaling as well. Things like green tea extract or EGCG can help get rid of or like bugs we don't want there. Again, this can promote some beneficial species. So it's like we need a combo of things. And I like when I'm choosing something for a patient, it's like, okay, first step is get rid of the weeds, right? If we're going to modify the microbiome, we have to move the sludge. If you're constipated, we have to move your bowels. Then we have to get rid of the weeds. So like, how are we de-weeding, right? How severe are the weeds? What type of weeds are there? Those are the questions we're trying to answer. And so we might use something that's more gentle or something that's more aggressive, depending on the type of overgrowth, the symptoms, and everything else that's there. Then we need to balance how long do we do this for so we don't overkill or, start killing the good stuff and really promoting an environment where some of the bad stuff can grow back, right? And then I really love a 2 birds, 1 stone situation. For example, like I said, ginger, anti-inflammatory, helps with motility, is a carminative, can help like digest food, but also has a little bit of antimicrobial activity. So I try to weigh, okay, what are our goals? How severe is the overgrowth? I wouldn't choose ginger in someone who I know has like a parasite and yeast, but I might choose it for just like a gentle support, right? Cinnamon can also disrupt microbial cell walls, can inhibit biofilms, and it's also good for blood sugar. So someone who's like insulin resistant, we might say, let's add cinnamon, right? So these are kind of all of the conversations we have in terms of what we do and how we influence the microbiome in a positive way. And obviously, there's a role for probiotics here, but it's a matter of like when, what strain, how long, how much, right? And so that's where some of that nuance comes in. But we do know it's a really important part of our strategy. And, the probiotic strategy depends on the goals too. Like if somebody has Crohn's, I might have them on probiotics long term. If somebody's going through a fertility, situation and they have a retrieval coming up or a transfer coming up, I might give them probiotics leading up to that, right? Vaginal and oral, to help support that environment and help promote implantation, right? And we know that from a diet perspective, there's a few hills I'm going to die on. Okay. From a diet perspective, the best way to modify your microbiome is number 1, variety. You can eat healthy, but if you're eating the same thing over and over and over and over and over, it's not going to be good for your microbiome. Okay. So just because you're eating healthy, let's add in some variety, right? Let's add in, the concept I often tell to my patients is I say, let's actually go in the grocery store and let's choose something. Maybe we just choose what's in season. Maybe we choose something like, I've never cooked that before. Like maybe I can add it to my sheet pan, right? Or, that vegetable's on sale. Let me get it. And then I'm just going to use trusty old Chat GPT to cook it, to look at all the ways I can cook. How do I cook a parsnip, right? It's not that hard usually, right? Or a fruit that you don't typically buy. What's in season? What can I add in? So variety. Number 2 is fiber. Everybody's so obsessed with protein, and obviously protein is important, but people are not dying from a protein deficiency. They're dying from colon cancer, and one of the biggest problems is a lack of fiber in our diet. And when you actually sit down and you look at your diet, you're like, but I have enough. I eat a salad for lunch. I want to challenge you to go through and actually calculate the fiber in that salad. I want you to just like throw it into Google. I had, a cup of romaine and I had a handful of cherry tomatoes and I had sliced up cucumber and whatever else is in your salad. And I want to see how much fiber is in there. The goal, bare minimum for most women, is 25 grams per day. And most people are not hitting that. Fiber feeds the good bugs. So we can't just take a probiotic and call it a day. And then you're like, well, what about a fiber supplement? Variety is important. We can't supplement our way into health. We can use it as a supplement, as a strategy, as a way to kind of, how do we get to the next step, right? But we can't supplement our way to health. Anyways, on that note, I'm going to end it. And if you have questions, you let me know.